In this video, I will talk about 4 causes of knee pain. And at the end of this video, I will show you some fairly simple exercises which firstly will help you strengthen your knee joint, and secondly will allow you to help yourself right here and now if you suddenly experience sharp knee pain. And the first cause is quite obvious. You all know about it very well. And you've heard of it. It's a knee joint injury. That is, you went skiing, went for a run, put some kind of improper strain on your knee, or simply hit it mechanically, fell on your knee, and as a result, you developed problems with your knee joint. If you've heard about this and know it, give this video a like. But there is one nuance here. There is such a thing as an acute injury, and there is also chronic microtrauma. What does that mean? For example, you have flat feet, such as a valgus deformity, or transverse flat foot, or longitudinal flat foot, or a varus deformity. There are some problems. If you have issues with your feet or ankle joints, your knees will suffer first, and even much faster than your feet themselves. Therefore, if you walk incorrectly, you create conditions for the development of problems. This leads to chronic microtrauma of all the joints, especially the knee joint. The second non-obvious reason, which you may not have heard of, is improper functioning of the gallbladder. This includes bends and kinks, as well as the quality of the bile itself and how it works. One of the functions of bile is the emulsification of fats, that is, breaking down fats. It creates, a kind of foam from these fats, and if this doesn't happen, if the bile doesn't emulsify fats for various reasons, due to reasons such as bends, kinks, stagnation, and insufficient bile production in the bile ducts by the liver cells, fats are not emulsified. In other words, fats are not fully broken down. If this doesn't happen, then fat-soluble vitamins are not absorbed accordingly. And these are vitamins A, E, D, and K. And once again, as in all my previous videos, I return to vitamin D. The normal and healthy functioning of our entire musculoskeletal system depends heavily on its overall health and balance every single day.
It just does.
Recent studies have shown that the viscosity of the synovial fluid, which is present in our joints, including the knee, depends on the fat composition of this fluid, on its lipid content. That is, our synovial fluid consists of fats and water. And just imagine, if the fats are not properly emulsified, their distribution in the body is disrupted. And our body simply takes away fats from the synovial fluid in order to redirect them to more urgent and serious issues, such as repairing blood vessels. Accordingly, a disruption in the distribution of fats throughout the body will lead to an imbalance in the composition of synovial fluid. It's important to understand that things break where they are weakest. If a person is predisposed to arthrosis or arthritis, the presence of a combination of factors such as flat feet or a malfunctioning gallbladder, which are also interconnected, will primarily lead to pain in the knee joint. The third reason is an increased viral load. Here, I want to specifically highlight a virus called cytomegalovirus. This is a virus. It belongs to the herpes group, which is present in arthritic knee joints. I'm not just making this up. A couple of years ago, we conducted a limited clinical study where we collected various fluids, for example, from a baker's cyst, which is a pouch that often forms with knee joint arthrosis. These are various cysts that were located on the patella in the wrist joint. And imagine, in all cases, we found the presence of cytomegalovirus. We performed DNA analysis and found it in every case. This indicates that the person's immune system is weakened. The herpes group virus is a resident virus. That is, it lives in our body practically from childhood until death and dies together with us. Accordingly, the presence of this virus in cystic formations gives me reason to assume that herpes group viruses, and in particular cytomegalovirus, play one of the key roles in the development of various types of arthrosis, including knee joint arthrosis. In order to fight this virus so that it does not remain in an active form, you need to boost your immunity. And if you boost your immunity, then this virus will calm down and will not cause any harm to your health. The fourth cause of knee joint pain is a lack of fluids in the body, a lack of water. An athlete came to see me. A young man about 30 years old with chronic pain in his knee joint, and only one knee was affected. Overall, he leads a healthy lifestyle, he has excellent bile flow, his gallbladder is working, and he has no viral load. Of course, he had chronic trauma, which he resolved by choosing the right footwear. And it turned out that he drinks an insufficient amount of water. Literally 2 weeks later, after we adjusted his fluid intake, he came to see me for a follow-up appointment. He was so joyful and happy and said, "Ruslan Faridovich, can you imagine all those years of knee pain are gone thanks to the fact that we added this one more component." It's important to understand that there must be a balance between fats and water. As promised, I'm going to show you two types of exercises involving fat. The first is to quickly relieve pain if your knee joint suddenly starts hurting. And the second is how to strengthen the capsule and ligament apparatus of the knee joint so that it doesn't hurt in the future. The first thing we do, first of all, you need to expose your knee. You need to uncover it to understand how this works. Your knee starts hurting, something happens suddenly, some kind of injury, and now your knee hurts. What do? You start making these kinds of movements. These tapping motions. You can tap like this for about 1.5 to 2 minutes. What are we achieving by doing this? We achieve an influx of fluid into the knee joint. This is very important. In other words, in this way, we activate the cells of all our systems for regeneration. Next, if your knee at the same time is very difficult to straighten, how do you straighten it? You take it with both of your hands, yes, and slowly start to straighten it like this, along the floor, on the couch, or on the bed, gradually extending it. If you suddenly feel a sharp pain, stop and gently shake it like this. And with these vibrating, shaking movements, we gradually, little by little, this process can take quite a long time. I do not recommend straightening your knee all the way, especially if it suddenly started to hurt sharply. What should you do? Slowly lower it like this and place, for example, a pillow under the knee area. Place it down. Relax your knee. What do we do next? Next, we take our kneecap with our fingers like this. And lifting it just a little bit, just slightly, you slide your fingers underneath it and rotate it clockwise or counterclockwise. That is either clockwise or counterclockwise. And for example, it rotates worse and is more painful clockwise. So you rotate it, hold it for about 10 seconds and then release it sharply. And this set of exercises will help you relieve pain in your knee joint, right here and now. Next, the place where the tendons attach, the attachment point of the lateral ligament. This is called the so-called goose foot. We also find it with our fingers and start rubbing it like this. And what's most interesting is that very few people will tell you about this. It's called the so-called rule of free practice. Here you'll find such a tender spot, and on the opposite arm as well. Where the condyles of the elbow joint are the condyles of the ulna, we find the same painful spot on the opposite side and start massaging it. If the pain is sharp, just look for a spot where it doesn't hurt, like here for example, see, it doesn't hurt, and start massaging that spot. So you work on this point here, and you must also work on a similar point. You'll definitely find it, and it will be painful, directly opposite. That is, if your right knee hurts, then look on the left side. If it's the left knee, then look on the right side accordingly. This is a set of measures that can help you right here and now and relieve pain in the knee joint. And the next exercise I want to show you is aimed at strengthening the capsular ligamentous apparatus and the muscular system of our knee joint. Here we are working with the popliteus muscle. It's important to understand that the popliteus muscle acts as a stabilizer of the knee joint and serves as a backup for the anterior cruciate ligament. When it relaxes, the anterior cruciate ligament simply starts to stretch along its axis. How do we strengthen it? We place the leg at a 90-degree angle, then pull the foot toward ourselves, and at first we start by moving only the leg. These movements, this exercise is called the boat. That is inward, outward, inward, outward. Next we involve the hands. How do we do that? We pretend as if we're playing tennis. So our foot moves inward, and with the palm we create resistance and push it outward. Next, as if we're sending it to the other palm, and with the other palm, we also create counter resistance. At first, your brain will get confused and not understand how to do this. And it looks like this. So one, we push and tense up. After a short while, you will really begin to feel a strong sensation, a noticeable tension in the specific area right behind your knee. This will clearly indicate to you that you have done everything correctly. Make sure to do this exercise every single day. In the morning, as soon as you wake up, without getting out of bed, you can combine it with tapping and working on the kneecaps. And then, after some time has passed, you will gradually begin to notice that the persistent pain in your knee joint has significantly and noticeably decreased.